Welcome, everyone. I'm Brad Doebbeling, Professor of Healthcare Delivery and Biomedical Informatics in the College of Health Solutions at ASU. I'm also a board-certified internist, an infectious disease epidemiologist, and health services researcher. I'd like to thank you for joining our Health Talks webinar, brought to you by the College of Health Solutions at ASU. Our college works to address the challenges facing people and communities to stay healthy, improve their health, and manage chronic disease. These health talks are one way that we serve the community with timely and relevant educational information that provides continuing education credit at no cost. And now for a quick couple of housekeeping items. First, this session is being recorded and it will be posted on our website, asuhealthtalks.com. After each of the panelists present, I'll moderate a Q&A session. Please submit your questions using the Q&A feature, not the chat box. Finally, you'll get a brief survey asking for your input about today's webinar. If you're requesting continuing education credits, this must be completed in order to receive credit. If you didn't apply for CEUs, we'd still appreciate your feedback to improve this series. So today's topic is timely. It's health, heat and health, how to help vulnerable populations. And we have two great speakers today with a lot of practical experience. First, Dr. Pope Moseley. Dr. Pope Moseley is a lung and intensive care physician and biomedical sciences researcher. At the University of New Mexico School of Medicine, he served as the Senior Associate Dean for Research, Chief of Pulmonary and Critical Care Medicine, and Chair of the Department of Internal Medicine. He's also served as the Dean of the College of Medicine and Executive Vice Chancellor of the University of Arkansas for Medical Sciences. For more than 30 years, Pope has led NIH-funded multidisciplinary translational research groups focused on heat-related illness and the adaptation of humans to heat stress. He is currently a professor at the University of Copenhagen and research scientist here at College of Health Solutions. Pope will be followed by Dr. David Hondula. Dr. Hondula is an associate professor in the School of Geological Sciences and Urban Planning at ASU and currently serves as the Director of Heat Response and Mitigation for the City of Phoenix. At ASU, Dr. Hondula helps to lead the Urban Climate Research Center and the Central Arizona Phoenix Long-Term Ecological Research Program. He's also on the steering committee for the Arizona Extreme Heat Preparedness Program and Resilience Work Group, and a faculty affiliate of the Maricopa County Department of Public Health. His research focuses on the social and health effects of natural and technological hazards, with an emphasis on extreme health and power failures. He works closely with local, regional, and state authorities on the development and implementation of plans and programs to make communities safer and more resilient. We're fortunate to have both of these health leaders with us today. So I would like to just introduce the topic very briefly. On the next slide, you can see a little bit of the background. We all know that burning fossil fuels releases carbon dioxide, which builds up in the atmosphere and causes the Earth's temperature to rise. And it's this extra trapped heat that acts as a blanket and disrupts many interconnected environmental systems. Climate change affects human health by increasing the frequency and intensity of extreme health events. It increases in the overall temperature of the atmosphere, which cause changes in wind, moisture, and heat circulation patterns. And it's these changes that contribute to shifts in extreme weather events, including extreme heat events. On the next slide, just briefly, some of the climate health connections. We know that extreme health events can be dangerous and even fatal to health. These events result in increased hospital admissions for health-related illness and increased cardiovascular and respiratory disorders. Extreme heat events can trigger a variety of heat stress conditions like heat stroke, which is the most serious heat-related disorder. It's where the body temperature rises rapidly, the sweating mechanism fails, and the body can't cool down. So it can cause death or permanent disability if the individual doesn't get treatment emergently. And we know that small children, the elderly, and others like those with chronic diseases, low-income populations, and outdoor workers are at particular high risk. And higher temperature and respiratory problems are also linked. So I'd like to again introduce Dr. Moseley, and he will continue the presentation.
Thank you, Brad. Everyone hear me okay? Great. Well, welcome to America's hottest city. I'm relatively new to Phoenix, and Phoenix is hot. We collaborate with a climate research group called the Cicero Center for Climate Research at the University of Oslo. They have modeled 100 US cities looking at interpolated numbers for temperature. And as you see in this slide, this graphic, Phoenix stands head and shoulders above all. Next slide. So in the next 20 minutes or so, I want to share with you several concepts. The first is that when we focus on heat-related illness, we're likely seeing only a small fraction of what impacts us during heat events. This is because heat worsens many, many diseases, which I'm going to call comorbidities for the rest of this talk. I'd like to examine some ways that we might be able to use comorbidities to identify people at risk of heat exposure. And I'm talking about individuals at risk as well as communities at risk. We can use these comorbidities to model who is most vulnerable in heat. Next slide. So again, our colleagues at Cicero, the Cicero Center, compared us with 100 cities, and they do a modeling of relative change in high temperature, average temperature, and low and high lows, lowest temperature. This high low is important because a high low temperature is highly associated with bad health outcomes. So when we look at the rate of change, and that is, what is the rate of the low temperature rising relative to the high temperature rising, Phoenix is again at the top. For comparison, these are the highs, the average, and the low temperatures of Phoenix and another large growing American city, Houston. And when we look at yearly rate of change in low temperature, high low, so the daily low relative to the daily high, Phoenix is 5 times greater than a city like Houston. Next. So I've spent a lot of my career, as Brad noted, studying the effects of heat physiology on and the effects of heat on people. And Maricopa County has actually done a very, very good job of working on this and keeps very good data. As Brad pointed out, there's a spectrum of heat-related illness, from heat cramps all the way to heat exhaustion, dehydration, and heat stroke. I put the ICD-10 code for the clinicians in the group for heat exhaustion, unspecified initial encounter, which is something that that we track in the clinical setting. Next slide. And then this is data from Maricopa County, and shows pretty well that as the temperature rises, the number of the percent of hospital visits due to heat-related illness rises. Importantly, Maricopa County is following this daily minimum temperature, so it's following the high lows, and showing you that as these temperatures rise, especially as the high low gets closer to the maximum, you start seeing a lot more admissions for heat-related illness. Next slide. But the question is, how well does this heat-related illness concept actually capture the impact of heat on health? Next slide. From the CDC data, we see that if you look at underlying cause of death for during the summer months, May through September, we see that heat is a significant cause of death. And when we look at underlying or contributing cause of underlying cause of death, it is much, much greater. Note that as we get out across past 2015, we see that we're recognizing the impact of heat more, and therefore the blue and the orange lines are beginning to diverge. So that we're recognizing that heat contributes significantly to overall mortality. From my research, I'm going to say that true heat impact is even much higher. Next slide. And I would say that the data shows, I've drawn two boxes that are to scale. The little black box on the left is what we'd consider heat-related illness. The big box is what the impact of heat is on disease. This is a simple, limited number of diseases that have all been shown to have where heat has a significant heat impact or health impact. And from my research, I would say that when we look at heat-related disease alone, we are really underestimating the impact of disease. Next. Next. So this is some data from New York City, from JAMA, the Journal of American Medical Association, 1998, showing New York City cocaine deaths and their change as temperature rises above 80 degrees. There's a hyperbolic rise in number of cocaine-associated overdose deaths as the temperature rises. And there's some physiologic reasons for this, but the point is that overdose deaths were noted to rise in New York City after relatively modest increases in temperature back in the late 90s. Next slide. So I did a sort of back of the envelope quick analysis of drug overdose as an example of unrecognized impact of heat on health. This is the data from the yearly data from Arizona, the bi-monthly data of drug overdoses and the yearly heat deaths. So I took the 3 hot summer months and compared them to 3 winter months. And so if you look at the totals, they're about 130, it's about a 33% increase, or about 130 more overdose deaths in the 3 summer months. That's 134 deaths in 3 additional deaths in 3 hot summer months. In 2019, Arizona counted 337 heat-related or heat-caused deaths in the entire year. Now, I'm not saying that every overdose death is directly associated to heat. I am saying that if you take one single diagnosis of overdose and you look at the myriad of diagnoses that occur, which are where heat plays a role, that we are seriously undercounting what heat is doing to us, and the impact of heat is really significant. Next slide. Next slide. Yeah. And this is what researchers looking at the overall mortality in London showed, that once you reach the temperature threshold, again about 85 degrees, that there was this heat curve that occurred where you had a marked increase in relative risk of dying when looking at daily mortality over many, many years, that clearly heat drives a lot of mortality during the summer months. Next slide. This is data from heat wave deaths in 9 European cities, showing that mortality increased anywhere from 10 to almost 60% in cities during a series of heat waves in the early 2000s. You'll note that although high intensity heat waves are important, duration really is a big factor. So duration takes into account the daily minimum temperature. So duration is as important as high temperature in causing more mortality. And this is an overall increase in mortality, in many cases above 50%. Next slide. And when you look at, this is kind of a busy table, which I apologize for it, but in these heat waves that were associated with these huge increases in mortality, the greatest effect on mortality was in people with respiratory comorbidities. So respiratory disease was what really seemed to be the problem. Now, we're talking about comorbidities, and I've spent the last 10 years working at the University of Copenhagen on trying to understand disease interrelationships using large data sets. It is my belief in looking at intensive care unit and critical illness data that a diagnosis of respiratory illness is actually just a marker for poor general health status, because most people who carry a respiratory diagnosis often have multiple other diseases. And so this is picking out the most vulnerable people by using a respiratory diagnosis. Next slide. So I see there are two real issues that we need to prepare for in looking at the heat impacts on health. Next slide. The first is that heat worsens many disease states. If we focus on heat-related illness alone, we're going to greatly underestimate the impact of heat on health. So our strategies, I think, need to focus on helping people understanding which comorbidities alone and, more importantly, in combination, are most likely to decompensate in heat, and helping individual people understand the importance of their diagnoses in relationship to heat. And I'd say we actually need to understand what is the phenotype of a heat vulnerable individual. Next slide. The second issue is preparation and management. We need to prepare health systems, and we need to tailor the risk information for individuals. We need to have disaster management principles like we do for hurricanes, earthquakes, tornadoes. We need to develop what I would say is the personalized medicine of heat. Personalized medicine of heat would be helping each individual know which comorbidities increase their risk, not just because of they're having it's heat-related illness, but because people will go to the hospital because one or more of their diagnoses, not called a heat-related problem, gets out of management condition. Next slide. So the personalized medicine of heat. Next slide. I'm going to say that comorbidities matter. We need to understand the impact of heat on these comorbidities. Remember that over 65% of Americans have at least one comorbidity, and 40% have two or more. So understanding the interaction of the comorbidities with each other, and then the understanding how heat worsens those comorbidities is really important. Next slide. So for this, I'm going to apply a strategy that we have used at the University of Copenhagen in my work there, something called the temporal disease trajectories, where we use individual diagnoses, large data sets of individual diagnoses, to create time-ordered networks of these comorbidities. Next slide. And these network trajectories, this is a picture of a trajectory from the article that's referenced in Nature Communications, studying the entire population of Denmark. In doing these trajectories, we uncovered a number of important disease relationships that were not really understood prior to doing this kind of analysis. Next slide. Then when you take these networks, you can go further. Using an artificial intelligence system, we've been able to predict an individual's chance of surviving an admission to an intensive care unit. So this is not the usual group data that we talk about. This is actually looking at taking an individual admitted to an intensive care unit and being able to correctly predict their likelihood of survival. Now, this strategy can be used to correctly predict anything from likelihood of a heart attack to likelihood of going to the hospital in a heat wave. Next slide. So for the community, the potential of understanding these comorbidities is that we can plan. We need to plan the way we plan for earthquakes and tsunamis, hurricanes. We need to try to predict the number of people needing care and predict which diagnoses and combinations are likely to deteriorate. Next slide. So for the individual, the potential of understanding these diagnoses will help us alert higher risk individuals during heat events. We can alert them based on their comorbidities. So I could envision perhaps a smartphone application where I would have an application that would I would enter my medical diagnoses. The app connects to my weather app on the phone, and I'm updated on my own personal risk of illness during a heat event. This is quite doable with the strategies I've described and with the technology that's available. We can actually help people as we've done with heart disease and critical illness in Denmark. And then we can target preventive strategies, heat acclimation through exercise. Some medications are make things worse during heat events. So perhaps medication alterations for those people at highest risk. And then importantly, notification to power companies to maintain or restore power, just as we do for all other vulnerable individuals. Next slide. So from the College of Health Solutions perspective, we need to improve health and heat. The program at ASU College of Health Solutions puts together human performance, population health, and health systems, biomedical informatics, and diagnostics. We have a number of important research collaborators. I've mentioned the Cicero Center for International Climate Research and the University of Copenhagen's Disease System Biology. The goal of the program, the Heat and Health program, is actionable data for health solutions using laboratory and computer and simulation to apply it to individuals and community. And I really think this personalized medicine of heat is an important issue. Next slide. So the personalized medicine of heat is really going to be important for many places. It's very important in America's hottest city. So thank you very much. And I will be happy to entertain questions.
Thank you, Pope. We're going to wait on questions until the end, but that was a great talk, really very evidence-based and some really cutting-edge data. So we're going to move now to Dr. David Hondula, who's going to talk a little bit more about the local perspective and what he's doing in the city.
Thanks, Brad, and Pope, thanks for your remarks. And at the city and in our geography and planning program, certainly looking forward to more collaborations with you and the college. Couldn't agree more on the many wonderful points you made. I do have to confess I was scrolling on my phone a little bit as you were getting your remarks going, but I came across a tweet just from 11:50 this morning. The Phoenix Fire Department, I don't know how well it's showing up on the screen, but they are on scene at Echo Canyon Trail at Camelback responding to someone experiencing a heat-related issue on a hike, and that person is in their 20s, a female hiker. I suspect we have some young folks who are on the line today, maybe folks who are new students to ASU or just back to the Phoenix area after being away. A good reminder that the risk persists through our warm season. This will be one of our cooler summer days. So just a reminder as folks coming back to the Phoenix area to please pace yourself and take it easy out there, given the dangers of heat that Pope just talked about. It's great to be on with you representing the city of Phoenix and some of our work to try to help vulnerable populations with heat. Let me get my slides turned on here. So I'm going to have a few different parts of my talk. One, just some thoughts on what the title of today's webinar might mean, how to help vulnerable populations. Then I'll share a little bit in terms of programming at the city, and we'll talk about a couple other related topics that might be of interest. Brad, are we doing okay on screen share? Everything look good?
Yes, looks great.
Fantastic. So I thought maybe too much about the words that were put together in the title, how to help vulnerable populations. I'm going to offer 4 different versions of an answer to that question. One is just what our approach has been at the city thus far in our first 10 months of having an office focused on heat. Here are some different ways that we are thinking about putting together help. Certainly gathering data and listening to the community. We heard a lot from Pope about what data gathering and analysis might look like and how to put it to work. I would also offer that when we're thinking about these words, vulnerable and help, we need to keep in mind that there might be different interpretations of what those words mean, and they might resonate really differently with different audiences. Certainly an experience we've had on the streets a lot this summer is that the type of help folks are interested in can be quite variable, and in some cases folks are not interested in help at that moment. Acknowledging, and boy, I think this really resonated with what we heard from Pope, acknowledging individual needs, context, history, this idea of personalized heat medicine I really like, and certainly is the way we're trying to think about our programs here. As city government, we do have responsibility for designing, implementing, and improving programs that are aiming to help people during our long and warm summers, and also trying to argue for additional resource and support, whether that's through grant applications or trying to make a persuasive argument to our elected officials or elected officials at other levels of government, how we can bring more resources in to help the most vulnerable members in our community. As Brad mentioned, I do wear an academic hat sometimes, so I thought a conceptual diagram might be helpful as well. We won't spend too much time looking at this. The link is here and the slides I understand will be available. But this is a conceptual diagram we put together a few years ago, thinking about broad factors that contribute to adverse health events. We were really interested in this role of exposure for the particular paper we were working on, what the conditions are people really experience as they go about their daily lives, how intense, how frequent, et cetera. But I think one way to think about helping is how can we modify what's happening in any of these boxes that are along the chain of events that could lead to an adverse health event. And for some people, that help might look like trying to modify local climates in cities. For other people, it might mean trying to build a population with higher fitness who can withstand heat better as they go about their daily lives. And of course, a really wide range beyond there. I also think, wearing my city hat, that it's important to offer some very practical and immediate opportunities to help. I certainly invite anyone on the line to join our direct heat relief outreach efforts called We're Cool. We're out on city streets 4, 5, 6 times a week. We spend a little bit of time at city trailheads as well. We'll be out this afternoon in Maryvale, and phoenix.gov/volunteer would be a great way to get involved. And because so much of the burden of heat in our community, at least the measured burden, thinking about Pope's comments, the measured burden is with the unsheltered community. I also wanted to offer another way to help, which would be to volunteer at an event called Project Connect at the Human Services campus in downtown Phoenix next week. Project Connect brings together many different social service providers to try to help folks living on the streets get access to medicine, shelter, housing, ID, food stamps. It's meant to be a one-stop shop, and a lot of volunteer support is needed and helpful to make it a smooth operation. Of course, anytime we can help someone transition from living on the streets to a cooler, safer, more stable environment, that can really reduce the public health impacts of heat in the community. To shift gears a little bit, wanted to just talk about what we're doing at the City of Phoenix and how we've been trying to reorganize how local government thinks about heat, manages heat, to try to meet this large and growing impact that we heard about from Pope. Pope referenced the county health department statistics, and we do have a wonderful surveillance program here. I think it's a world-class surveillance program for heat and health. And unfortunately, that world-class program is showing that our numbers are moving in entirely the wrong direction here in Maricopa County. So if you're looking for a way to make an impact in, if you're a student or faculty member or community partner, if you're looking for a topic where we need help, heat and health is certainly one of them. And there are many different ways to get involved. Since 2014, we've seen countywide more than a 450% increase in reported heat-associated deaths. That far outpaces anything we'd expect related to population growth, anything related to demographic transition, and frankly, anything related to climate change. This amount of change is just too fast compared to those other processes that move more slowly. We believe that this trend is largely attributable to the increase we've seen in the number of unsheltered folks in the community and some related patterns in the use of substances in the community and so on. No group is at higher risk as we look at the data than our unsheltered neighbors, 200 to 300 times higher risk than the rest of the population. So as we see more folks unfortunately wind up in those circumstances, it might not be a total surprise that these numbers have pushed upwards. We also we're trying to interpret heat more broadly than just adverse health events, thinking about long-term impacts on health and quality of life. This is a quote from a community heat action planning process that the Nature Conservancy convened with community-based organizations a couple of years ago. And as you're reading the quote, you get a sense that this resident was making a connection between how hot it is outside and the likelihood that their children will have chronic health conditions over the long term, nervous that they're not getting enough physical activity in the summertime. And we recognize that the city that heat can be expensive for healthcare costs and other types of costs, as residents of the area appreciate. A lot of stuff just tends not to work as well, or it breaks more quickly in our summer months. And the Nature Conservancy commissioned a study with the consulting firm AECOM. They estimated an additional approximately $2 billion in costs related to heat by mid-century if we don't do better at trying to manage this, this particular hazard. We're approaching heat from an equity lens, and ASU has a terrific history of studying the equity dimensions of heat in cities. I think it would be fair to say that ASU was really the pioneering institution dating back to the 90s and 2000s in understanding that heat is an environmental justice concern, just like so many other hazards out there. This particular figure from our colleagues Daryl Jenneret and Sharon Harlan looked at how different neighborhoods compared to one another in terms of how hot they are as measured from a satellite, and how many people say they get sick from heat in those neighborhoods. And you can see the line goes up to the right. Neighborhoods that were hotter as the ground temperatures measured by a satellite tended to have more people who said they get sick from heat. We also know from ASU research and a lot of other research that those hotter neighborhoods tend to be home to folks with lower incomes, tend to be home with people of color, and tend to be neighborhoods that have been historically underinvested by institutions over many, many decades. We had the chance to convene a workshop with the State Health Department and Weather Service several years ago, where we looked at some of the excellent reporting that the Arizona Republic had produced at that time, called The Human Cost of Heat. This was in 2017. The story came out about what was happening in 2016. And I think for those who are interested to get a greater familiarity with what the impacts of heat look and feel like, this would be an excellent resource. You could still search for this series on the internet today. It's still accessible. And if you were to click on any one of these faces, you'd wind up reading a couple paragraphs story about this person's background, and in many cases, the circumstances that led to a very tragic outcome, their premature death related to heat. We convened many practitioners in the area. We looked at some of these narratives, and we asked different organizations, government, non-government, where could your organization have intervened? Where could your organization have done better to stop the chain of events that led to these terrible outcomes? And unfortunately, there was much more silence and confusion in the room than there was organizations clearly voicing exactly how they could have helped these individual scenarios. You can see our politically massaged conclusion here on the slide. Workshop participants had differing ideas. Who bears responsibility for preparing for and responding to extreme heat? What has emerged from ASU research and research from many other institutions, that there's been a governance gap for heat. Who is going to be implementing the programs that address the personalized heat medicine we heard about from Pope? Right now, in so many cities, we're looking around at each other, wondering is it your job? Is it my job? And I hope we all agree that if it's not clear where the responsibility is, it's very likely that we're going to have missed opportunities to help protect public health. So mayor and city council here in Phoenix got wind of this idea of the governance gap. They were aware of the public health impacts of heat, and that they're growing and that we're headed into a warmer future. And they thought we needed to do something different. In the 21-22 budget, so that was the previous budget cycle, they put forward a nearly $3 million package called the Climate and Heat Readiness Investment. The single biggest component of this financial package was for more tree planting in the city of Phoenix, which we know is a really high priority for so many neighborhoods. But the part of this investment that I wanted to highlight for you all today is that the city created the country's first publicly funded office in local government focused on heat. So that confusion about who's responsible for improving the programs and services that can prevent or intervene ahead of some of these heat illnesses and deaths, it is clear where that conversation at least starts in the city of Phoenix right now, and that's with our new office. We have 3.5 staff positions, and we'll be growing later this year. We have somebody who focuses on cooling strategies related to trees, somebody who focuses on cooling strategies unrelated to trees, and we work with many, many other departments as well to try to implement a wide range of programs and services that can help cool the city over the long term and can help protect people's health right now. I'm going to skip ahead a slide here and just talk a little bit about what we've been up to in the first year of having an office in local government focused on heat. Certainly a lot of dialogue with community partners, like the conversation we're having today. We had the chance to help coordinate a big kickoff event for a new tree planting initiative in the city called Cool Corridors with our partners at American Forests back in the spring. We helped author the city's first ever heat response plan, a singular document that describes the ways that we are attempting to protect people during the summer. We learned in that process that the city has more than 30 different programs and services that are related to heat response in one way or another. And this was the first time that we could identify that we've had them all written down in one place, which gives us a good starting point for trying to understand how we can improve them and how we can evaluate them. We've been distributing heat relief supplies to now more than 50 local organizations that do heat relief outreach. I think more than 40,000 individual items are out there. We know that the city can't reach everyone and is not necessarily the most effective team to be reaching everyone. So we've been really happy to champion the work of so many other organizations out in the community. And thinking about the value added for having an office focused on heat and local government. The city has recently received its second big allocation of American Rescue Plan Act funding to the tune of approximately $200 million. And we successfully argued for a portion of that investment to be allocated toward programs and services related to heat in one way or another. In the absence of a heat office, would those same investments have been made? Impossible to know, but I do know that we were in the room arguing for those investments to be made, and we were so thankful that City Council supported those ideas. I wanted to jump for just a few moments and talk about particular pieces of the heat response plan. And I think it's particularly interesting as we look into the future, trying to align elements of our heat response plan with this idea of personalized heat medicine. At a very high level, the heat response plan had 3 goals: to bring down the number of heat-associated deaths in the city of Phoenix as the county would measure it, bring down the number of 911 calls related to heat in the city of Phoenix, just another one added to the record moments ago as we saw. And our third goal is to really take a deep look at all of our programs and services related to heat after the season, understand what they are, how they work, how they're resourced, how they are working together or not, and what we can do better next year. We categorize the heat response programs and services in the city into 6 big buckets, and we won't spend any time talking about each and every bucket, but just wanted to throw the words on the screen to perhaps help expand our thinking about what heat response programs and services might be and what some of the different domains are where the city has been focusing. To highlight a couple of the specific initiatives in the heat response plan, we have been trying to do a much better job this year building situational awareness at City Hall. What is happening in the community? What are we seeing in near real time for heat-associated deaths, heat illness? Are people calling 211 and 311? What is the commentary like on social media. We've been aggregating that all together into a weekly report that's sent around to department leadership and many other community organizations to just build our knowledge of this hazard and its impacts that have been so under discussed for so long. And we get a lot of good feedback about those reports from many colleagues. Just to pull a particular graphic out of this most recent report, here we're looking at the cumulative number of 911 calls related to heat in the city. This year, that's the red line. Compared to last year, that's the gray line. And you can see that we are not where we want to be thus far. The red line is tracking ahead of the gray line. This summer has been a little bit warmer than last summer, which is partially responsible, but also a major factor than the increased number of folks who are living on the streets. Amy Schwabenländer from the Human Services Campus was on Arizona Horizon earlier this week, and her data suggests that there are 2 to 3 times as many people living on the streets outside the Human Services Campus this August compared to just a year ago. And again, all the data suggests that is particularly impacted population by heat. I certainly would like the audience to be aware that there is a network of facilities called the Heat Relief Network that are open to the public for either water or cooling off. The Regional Heat Relief Network is coordinated by the Maricopa Association of Governments. You can search for MAG Heat Relief Network and find the interactive web map. Free transportation is available to those locations 7 days a week, 8 to 5 by calling 211. And so many of the folks who are out living on the streets don't have regular access to a working phone. This 211 call is a call that each and every one of us can make as well. So it could be a great way to help if somebody looks to be in a little bit of heat distress, needs somewhere to go cool off, and it's not a medical emergency. We can make a call to 211. 211 deploys lift and will take folks to and from any of these public locations. As I mentioned before, we do have direct heat relief outreach program at the city called We're Cool. We've tried to use a number of different data sources to understand where we need to be in the city. We visit about 10 different locations on a rotating schedule. And this year, for the first time ever, we've included case managers from our homeless services team. So we're not just giving out water bottles, we're not just talking about cooling centers, but we are able to have conversations on the spot about housing, shelter, food stamps, income, hygiene services. And we think that connections to those social services are really the big wins that we're after that can build our resilience over the long term. Some folks might have seen in the news that there is a new heat relief shelter that the city has stood up in partnership with the county, St. Vincent de Paul, and Community Bridges this year on the east side of the city, roughly 2800 Washington Street. All indications are that this has been a big success thus far, daytime and nighttime relief. The shelter has been essentially at capacity since it's opened. That is, of course, reducing exposure by a considerable margin for many of our most vulnerable community members. So going back to the title, helping vulnerable populations, I think this is one really important version of help, is simply building more space where folks can get relief from the heat. And just a couple of other highlights here as we're coming to the Q&A period. I certainly anticipate that many audience members are renters and might be renters in the city of Phoenix, and wanted to ensure you're aware that there is a cooling ordinance in the city that will help protect you. Your unit is required to be able to be cooled to 82 degrees if there's central air conditioning, 86 degrees Fahrenheit if there's evaporative cooling. And if a landlord is not responsive or not complying with these expectations, they are in violation of city ordinance, and the city will intervene to help you. And that's through our neighborhood services department. Please don't be shy. As we heard from Pope earlier, heat is a life or death topic, and it is a time-sensitive topic. We don't want to wait if we hear of a case where an air conditioner has gone down and is not being repaired in a timely manner. Please don't hesitate to make that call. So I'll just very briefly acknowledge that there are so many partners doing amazing work that's part of helping vulnerable populations, the programs at the county, the weather service forecasts, what the utilities do to keep the power flowing, utility assistance programs, and some really cool capacity building work that the Nature Conservancy and Phoenix Revitalization Corporation have been doing through their Urban Heat Leadership Academy. So if you're interested in getting involved, There's a regional work group. We'd be happy to invite you to the conversation and help do a little matchmaking. If ASU is not the right home for your heat enthusiasm, or the city of Phoenix is not the right home, I'm sure we can find a home for you. I'll just skip over these last couple slides, but they'll be available on the recording. They just refer to some of our longer term cooling strategies. While we're certainly focused on public health and preventing heat related illness during the summer, we know that urban design or urban forestry and other tools are in our toolbox to help cool the city over the long term and make it more comfortable for everyone. With that, Brad, thank you to you and your team for the invitation. I'm really looking forward to our discussion.
Thank you, David. That was a great talk as well. That was really exciting about what you're doing. Thank you. So we've got a few questions in the question and answer option. Please add some more if you would like to. There's a question from Neil Robbins. He says, there's a large jump in heat-associated deaths in Phoenix between 2019 and 2020. What roles did the pandemic play?
Yeah, I will let David join in as well. The pandemic did play a role, I suspect, in 2020. Those are drug overdose deaths. And so the pandemic, of course, had a strong impact on mental health as well. Had I used the 2020 data, it would have looked really compelling. Therefore, I chose the data before COVID to focus on a time when heat was the major issue. But you're right, some of that could be heat as well. And again, this is one diagnosis. There are 100 or more diagnoses where heat has been shown to play a role in contributing to death.
Thank you.
Pope, I'll just add, I expected that we'd see a positive indication of COVID in the records of so many decedents in summer 2020. It would seem to me as a non-medical expert that having COVID would increase one's heat vulnerability. And that turned out not to be the case, with the exception of just, I think, 2 or 3 cases in 2020 were positive for COVID at the time of death. So the connection between COVID and the jump that you talked about has to be through some longer or more indirect pathways, maybe related to difficulty accessing other social services in the community, maybe related to challenges in with rent and eviction. I think we need to think quite broadly about what those causal pathways could have been. But it didn't appear to be a direct biological link, which was surprising to me.
Yeah, I agree. I think that the data on the jump in overdose deaths, it could be very well be a social issue related to COVID. 2019 is pre-COVID, and you still see a 33% increase in overdose mortality in the 3 hottest summer months. That's a big jump, and I think heat is a less well recognized problem in overdose deaths, as well as in a number of other things. So yeah, David, I agree.
Thank you, guys. Great answers. So Jeremy Cantu talks about seeing a Vox video that showed that if you mapped the Phoenix metro area, surface temperatures correlated to areas of poverty, mostly due to the lack of shade compared to other areas of the valley. What can be done at the local level to help ameliorate this problem?
Yeah, well, maybe I'll take first stab at that one, Pope, but we'd love to hear your thoughts. We need to invest in those communities, and I'm really happy to say that those investments are coming. And I don't know if they're coming large enough or fast enough, but they're coming larger and faster than ever before. Part of the American Rescue Plan Act funding includes a $6 million residential tree planting program. That'll be the largest single public investment in urban forestry in the city history, as best we understand it. And we recognize that investing in people is equally, or maybe even more important than investing in plant material. So part of that effort will be to hire and train local community tree stewards. We'll figure out a better name perhaps, who can help neighbors work with neighbors to ensure that trees can grow successfully to maturity, which is of course a challenge in our desert climate. We also recognize that trees take time, and we're looking very closely at engineered shade options. $3 million of American Rescue Plan Act funding coming toward engineered shade. And there are other complementary funding sources like the Transportation 2050 tax measure, which is adding more shade at city bus stops every week. More shade continues to be available there. So investment and engagement, I guess, would be my short answer to the question.
Yes, just to add to that, our colleagues at the Cicero Center for Climate Research show us that Phoenix is the worst at it has the greatest rise in urban heat of any large city in America. If there are two simple things you can take from this talk, I'd like you to think about this personalized medicine of heat, and I'd like you to think that in Phoenix, the big hidden health disparity is heat. That heat exposure to the most vulnerable are the most stressed by this killer.
I'm going to follow up with that if I can. And I know that there are people in the audience that have strong interest in trying to affect policy and investments. And you both have talked about very proactive programs and strategies using research and partnership and engagement. But if you could wave your magic wand or had a big rich donor who wanted to make a big impact, what would be on your wish list for investments and new policies to help it in this area where it's such a problem?
Housing and accompanying social services, but housing right now, it hits us. It will be out on the street in 3 hours, and we will see the challenge of the housing affordability crisis tragically. So that's mine. And I think it's interesting as a person who comes from a heat and climate orientation that I've wound up settling on that answer versus anything that is explicitly heat related. Okay,
thank you.
I'm a heat big data person, and my what I would add is housing. That's the big one. We are faced. There are a huge the people who are on the street carry multiple diagnoses that are most likely to be affected by heat. We have a real health emergency.
Thank you both. Couple more questions. Here's a question from someone who's identified as H, maybe for heat fanatic. So for shelters, is there a plan to use solar panels as stalls or cover to provide shelter and energy at the same time, especially in Arizona where we have so much sun?
So I could say, yes, there is a plan, and I think we see great success on ASU campuses using solar structures and many city facilities as well. I look across the Washington Street right here, we'd see big solar array, but of course it's not everywhere that it could be. I do know this is in the works for the bond measure that is being proposed here at the city. New $500 million general obligation bond will be coming hopefully to the voters next year. And there's a lot of discussion of solar as part of facility upgrades. What we need to look at in our office, beyond those particular facilities, is what are the expectations of, what is the guidance for, what are the incentives for, what's the appetite of the private community? I don't know if H would advocate for this being a requirement, parking lots at a certain size, for example, but that possibility is something that I think our office is tasked to explore. What could that even look like?
Great. We just have a few more minutes for questions, so please get them in if you have a few more. So from Dr. Sabrina Osterly, I'm curious about, and maybe somewhat doubtful about, the idea of personalized medicine of heat. Seems that the biggest impact on reducing heat-related deaths would be to support the unsheltered population. How can personalized medicine help with that? Would the panelists comment?
Yes, from my point of view, there are certain diagnoses and combinations of diagnoses that make one most susceptible to heat, so that if we are going to prioritize in any way protecting the most vulnerable, trying to understand which people are among the vulnerable are the most vulnerable. And that's where the personalized medicine of heat comes in, understanding that the person, we see the issue of substance abuse, but when we add substance abuse to asthma, to chronic renal disease, we start finding people who are even more, the most vulnerable among the vulnerable. And as we prioritize understanding which people are most vulnerable is important. Also getting an understanding of within the population who are considered vulnerable, how many people constitute the most needy before they get sick and go to the hospital. So that would be my answer about using a personalized medicine approach.
That's very helpful. Thank you. So from our Dean, Deborah Hellitzer, we know that heat and water are possibly correlated in their impact on health. Since Arizona is now becoming a state that needs to restrict its water consumption, what is the city and perhaps the region doing related to preserving water?
Yeah, I don't think either of us is the top water expert, but they are out there. But speaking from my corner, and thanks for the question, Dean Hellitzer, our water strategy team reminds us every day that we overwater outdoor landscapes by such a high amount here in the Phoenix metro area. Even desert landscaping is overwatered. So they see conservation messaging as a really important tool in the toolbox here. I have not done the math yet. It's on our to-do list, but I wouldn't be surprised if all of the water necessary to support whatever ambitious urban forestry goal we might have is already being deployed to landscapes, and it's simply a matter of rerouting where that water is being used. We do need to be really mindful about species selection. I see there's a species recommendation elsewhere in the Q&A, and I was looking at how what its water use it is, and it looks like it's classified as low water use, so that's moderate water use there. So really mindful about species selection and maintenance practices. We can't waste water growing trees that won't survive. Of course, there are larger investments being made to move water in our region from one service area to the other. And I don't know what's coming our way in terms of restrictions, but it has been very clear from city management that compromising urban forestry goals is not on the table as we move into a tougher water era.
All right, thank you very much. Just a quick question from some of my reading and preparing for this. There were recommendations about using green roofs where people are starting to plant, particularly in the cities, their roofs. Can you comment on that? Has that been shown to be beneficial, and is there?
Yeah, I can briefly comment. Matt Georgescu is a researcher at ASU. He's a regional climate modeler, so he simulates what different types of interventions like green roofs or reflective roofs might have, and he has some wonderful work comparing the efficacy of these types of options all over the country. And his data show that in our area, because of our water and irrigation challenges, reflective roofs are probably a better investment than green roofs. Now, it's hard to think about and measure all of the possible co-benefits with food production, habitat, etc. But a non-irrigated cool roof performs just as hot as an asphalt roof in many cases if we let the grass and plant matter die. So we have not been pushing very hard on green roofs, but there are some interesting examples out there, some buildings in Scottsdale, the Tempe Transit Center. I think it's part of the mix, but we need to get water up there and we need to keep everything alive. And that's just a little harder here than it is in Portland and New York.
Makes sense. Thank you. Well, I think we'll end it there. Thank you to the speakers today for really great evidence-based presentations that are cutting edge and had some very novel strategies that are being put in place here with both research and programs in the Phoenix area. Thank you for your work. And I wanted to appreciate the audience and their great questions. Please join us in the future for our next event, which is Understanding Monkeypox Status and Prevention on September 15th. There will be a recording posted on asuhealthtalks.com, and don't forget to follow us on social media at ASU Health on Twitter and ASU Health Solutions on Facebook, LinkedIn, and other approaches. So thank you very much. And I really enjoyed the presentations. Have a great day.